Hi, I'm Harbir Singh and I'm the Barefoot Doctor. Today I wanted to talk to you about selfless service, in particular selfless service of your parents. Now, massage has been used for thousands of years to improve circulation, blood flow and drainage to an area, and recent studies have shown that you can improve healing from using basic massage techniques that you can learn here today. I'm going to show you a couple of techniques that you can use to relieve aches and pains that your parents or somebody you know may be experiencing. There's three key areas where people develop aches and pains. They are the head and neck area, and that's due to posture and stress, the lower back area, and again that's due to similar elements, and then the legs area, especially the calves with the older generation. To start off with the head and neck area, there's two main muscles that we need to look at. One is the suboccipitals. The suboccipitals are at the base of the skull, and these muscles are very much related to posture, and because all of the nerves that come out of the brain and spinal cord cross through this area, tension in these muscles can cause a large number of symptoms, including neck pain, stiffness and also headaches. We're going to be looking at the trapezius muscle. The trapezius muscle is the muscle that often has mule duty, which means that when we hold bags or when we talk on the phone on one side with our head towards one side, we often overwork these muscles and we often develop knots and aches and pains within our shoulder area because of these postural elements. So the first muscle we're going to look at is the trapezius muscle. It lies in this portion of the shoulder, and it's a muscle that commonly does mule duty. So when we hold a bag, it tends to be overloaded. When we tilt our head in order to speak on the phone or use a mouse, this muscle tends to develop a lot of knots, and it can be very painful. It can also cause a dull ache into the shoulder area or restrictions in how much you can turn your neck from side to side. So if your parents have pain in this area, and pretty much everybody does, then this is how you can release it. So this is the middle of the muscle, it's in here, and in order to apply pressure we can use a fist contact and just place our fist into that area. We can look at the person we're working at, we can look at their face and see how much discomfort they're in. It looks like it's the right amount of pressure. We hold that contact for 30 seconds and then we can release. So one shoulder should feel a lot looser and a lot lighter after our release, and then we want to work into the other side as well. For the suboccipital muscles, we come off the base of the skull. Our contact is again a fist. We asked our parents or the person we're treating to turn their head to one side, and again we apply pressure from upward to downward motion, so from the back of the neck down towards the floor. In order to know how much pressure is enough, we need to communicate effectively with the person we're treating. We apply pressure from the base of the skull downwards, and we ask the person we're treating whether the pressure is enough, and they'll be the best indicator of how much is enough. It should be painful, but it should be a good type of pain. After we release, they should feel a significant amount of relief in that area, and their neck motion should have improved. With this technique you want to be careful of anybody who's very elderly and has a lot of arthritic changes within their body. So if you know someone's got a lot of arthritis through their body, you want to be very careful with how much pressure you're applying, and that goes the same for any technique. You always want to take into account the person you're working with. If they've got osteoporosis or if you know they're very frail, the contact you want to use is very gentle.